Good afternoon. This is Dr. Havens with our recorded lecture for Unit 5 of the Leadership course. This unit will consist of the material in our textbook from chapters 13, 14, 15, and 16, with an emphasis mostly on 13, 14, and 15. We don't have a lot that we will need to do with chapter 16. Our first lecture is Chapter 13, Promoting a Healthy Work Environment. This is going to focus highly on workplace stress and psychological factors. The objectives that we are going to focus on for Chapter 13 have a lot to do with learning about the impact of burnout and stress, both on individual registered nurses as well as the healthcare team and the facility as a whole. We are going to learn strategies for stress management and also to experience joy in our work. We will make suggestions for promoting a healthy workplace, and we are going to identify specific instances related to sexual harassment, bullying, types of discrimination, and incivility in the workplace. So we know that nursing is a team effort, and effective group communication and team building, as well as strong leadership skills, are essential to getting the work done and achieving adequate or excellent patient care. We are not here to do this on our own. We work in teams with other people to accomplish our goals. So the day-to-day interactions that you have with your supervisor and also with your colleagues can have a major impact on the quality of your workplace satisfaction and your ability to get the job done. In a supportive environment, most people are willing to take on difficult decisions, take initiative, go the extra mile, and get things done and help out coworkers. However, in a not so supportive work environment that some of you may have experienced from time to time throughout your previous career, members of the team are often afraid to take initiative. They don't want to get criticized or told that they are wrong and that they shouldn't have stepped up. They may avoid decision making, maybe morale is low, and they just don't have the energy for it. They tend to limit their commitment to their coworkers and also, unfortunately, to the patients in their care. Most employees really can feel the difference between a supportive and a not supportive work environment. We all know which one we're in. And also incivility or daily, these are usually daily or near daily verbal microaggressions or criticism or non-supportive comments also lend themselves to a negative work environment, and this can really affect the quality of the workplace in a not so positive way. One thing that's very important to workers of all types, professionals and non-professionals, is to have a voice in how their work is done. It doesn't necessarily mean that the employee expects to have decisions go their way all the time, but I think it's important for everyone that their voice be heard. Nursing is a profession where we often don't feel like our voice is heard. This can be frustrating because we know that if our voice was heard by upper management and if our opinions were taken into consideration, that this could improve the quality of the workplace and also the quality of patient care. There are many ways that the nursing profession has advanced over the years, and we have to be grateful for small victories. When I first started working as an RN in the 1980s, I worked at a hospital where when you worked the weekend, the RNs were expected to take out the trash in the patient rooms at the end of every shift because there was very limited housekeeping staff available. As you can imagine, this was kind of demoralizing, and it just added one more task to our already busy day that we really didn't need to be doing. However, over the decades, this has changed, I think, partly to the perception of RNs as professionals, but also due to the increased research and emphasis on infection control. We now know that the housekeeping staff is vitally important in the prevention of HAIs and nosocomial infections. So fortunately, I think that most hospitals do have the trash taken out and by housekeeping or other non-nursing staff, and that they have adequate housekeeping 24/7. There are many actions that can be taken to empower nurses and the nursing profession. We read about this all the time in nursing journals, and we hear this at nursing conferences. There are barriers that should be removed in our decision making or lack thereof, such as the unit practice councils that we talked about in a previous unit. There should be a nursing unit practice council for every unit in every facility, and there should be shared governance in which the decisions made in that council are considered or even binding upon upper management. This would improve patient care, and it would improve the quality of working conditions for nursing. As we know, in some hospitals, turnover is high. This is very costly to the hospital, and it decreases the quality of patient care because nurses' voices are not being heard. Our professional associations and the facilities that employ us should be making public expressions of confidence in the value and capabilities of nurses. If you think about it, in the hospital, most of the care that helps patients get better comes from nursing and not other parts of the multidisciplinary team. The physician performs a procedure or the surgery, and then he or she is done. The physician comes and makes rounds for 10 or 15 minutes on that patient every day. Nurses are the ones at the bedside 24/7 helping this person to get better. Public proclamations of the value of the nursing profession should be made on social media and on television and elsewhere, other than just the first week in May during Nurses Week. We also need to promote people within the nursing profession who can demonstrate a lot of self-confidence and also competence. A lot of nurses have felt, particularly women, I think, over the years, that their opinion is not valued, and this has adversely affect our self-confidence. If I'm so good, why aren't people listening to me? If people don't listen to me, therefore my opinion may not be of any value. And this is detrimental to our self-confidence and ultimately to patient care. So let's talk for a minute about the increasing need for continuing education. Research is going on all the time. New nursing research is published in journals and on the internet all the time. This is why we have to do continuing education courses and training on our job to stay abreast of what affects us in terms of our ability to perform quality and evidence-based patient care. The responsibility for change and staying abreast of the latest changes, as well as the responsibility for innovation, which is creative change, lies with upper level management in any organization. However, in healthcare facilities, some of the ways that first line nursing leaders can, pardon me there, forgot to take my Zyrtec this morning. So there are some ways that nurse leaders on the nursing units can help promote a climate of professional growth. This is to encourage nurses at the staff meetings to do critical thinking, share opportunities for new projects that could be done to improve the workflow or patient care, and reward people for professional growth. If someone gets a new certification, if they attend a conference and come back with a certificate, they should be asked to share what they learn, maybe have their name in the weekly newsletter, or do something nice to recognize people for their efforts. Staff recognition programs have been demonstrated through research to be a good way to improve job satisfaction among nurses and other groups of professionals. It helps to improve self-esteem and morale, and also provides a social outlet for people to get together and just be recognized and feel appreciated. In my opinion, this should happen more often than just once a year on Nurses Day. I think that everyone has probably, in the nursing profession, has had the experience of feeling that the facility that employs you wants to be supportive. Maybe they just don't feel like they have the time to get it together adequately for Nurses Day and do something significant or meaningful or even really nice. I had an experience several years ago of working in a hospital where it came time for Nurses Day, and we were all invited to attend an ice cream social in a conference room, and it was from 2 to 4 p.m. It was drop in when you had time. So it was very busy on my unit, and around 3:30 we decided, well, we just have to drop what we're doing right now and run down there to the conference room and do this if we're going to do it. Otherwise, we're going to miss out. So it was 3:30, and my coworker and I got to the conference room, and the door was locked and the lights were turned off. So I was confused about why this event wasn't happening. We went around the corner to the nursing administrator's office and asked what had happened to the ice cream social, and her response was, well, we ran out of the ice cream already, so we stopped it early. So as you can imagine, this did not contribute to my job satisfaction. They couldn't even be bothered to make sure that there was enough ice cream on hand for everybody on my shift. So another topic that needs to be addressed in this module is the idea of horizontal violence in the workplace. This is such a problem that it's actually recognized by the Joint Commission as a sentinel event because it can pose a threat to patient safety. I don't know if you've ever been in a situation on a job where something has happened. Maybe it wasn't because someone was harsh to you or that kind of thing, but something happened that had you so rattled or upset for a minute that you felt that you couldn't go to the bedside and do your patient care. Maybe you had to go take a 10-minute break and walk outside or go to the break room or that kind of thing. So this can cause a delay in care, a loss of focus or attention on what you need to be doing because it can be very stressful and upsetting. So we know that this can have adverse effects on patient care. In this type of behavior, we're not referring to anything that leads to physical violence. This is more along the line of bullying, or what we now call, the newer term for this is incivility. It includes verbal humiliation, malicious gossip, could be excessive punishment on the part of somebody in a leadership position, and just any verbal abuse, excessive harshness or criticism in general. It could be done by people who work under you. It could be the UAPs or CNAs inflicting this upon nurses. It could be people in management, or it could be your coworkers. Regardless of where the perpetrator of this is on the organizational chart, it can cause a great deal of distress to others. So who does this type of behavior? Probably all of us from time to time, unwittingly. I don't believe that any of our coworkers set out to be bullies or to verbally abuse us. I think that when there's stress in the workplace, when our voices are not being heard by people in management, sometimes there is frustration, and the only way to let it out is to take it out on your coworkers, even though you totally do not intend to do them any harm. So how common is incivility in the workplace? It's certainly not rare. Studies are showing that about 40% of nurses in the US report having been exposed to bullying. What does this look like? It may be related to a general lack of support, poor communication. You don't feel like you're in the loop with important decisions. You feel like you're getting left behind on changes that are happening, so you can't do your job adequately. Or it may be the presence of cliques. Only certain people are allowed to have the information that they need to be successful on the job. Incivility needs to be addressed by making a report of this to the nurse manager. Strategies for handling it on a particular nursing unit can be discussed in staff meetings. We need for upper management and everybody in a supervisory position to role model appropriate behavior, and we need a zero tolerance policy to put everybody on alert that this is happening and that it's not going to be tolerated. Another problem in the workplace is sexual harassment. This is persistent in spite of the fact that the EEOC, a federal agency, that stands for the Equal Employment Opportunity Commission, says that this is a violation of federal law when this happens in the workplace. So usually this has to do with an unequal balance of power between male and female employees, although anyone can be the victim of sexual harassment. Two forms of sexual harassment that you want to be familiar with are quid pro quo. This has to do, it's a Latin term that means you give something to get something. So sexual favors are solicited or asked for in exchange for a promotion or maybe to keep the job or that kind of thing. So this is illegal according to the EEOC and federal law. The other form is a hostile work environment. This is kind of difficult to prove. This is kind of like where the employee alleges that they've been discriminated against based on psychological injury because they weren't responsive to maybe a request for a date or that kind of thing with a coworker or a superior. What types of behaviors constitute sexual harassment? These have been defined as making comments about a coworker's gender or either their body, pressuring someone to participate in a sexual activity, even off-color jokes or that kind of thing, or asking someone to meet you outside of work or for a date after they have expressed an interest in not having an outside of work relationship with you. It's important to raise awareness about the issue of cultural diversity in the workplace. Often we have to work with and care for people who have very different traditions and communication styles and beliefs about the world that are different from our own. Healthcare organizations tend to foster diversity, and they want to make sure that employees respect and understand the wide range of human characteristics, and that we, going back to the concept of social justice that we talked about in a previous unit in this course, that we care for everyone equally, regardless of race, color, creed, what language they speak, and so on and so forth. Maintaining respect is the basis of all cultural competence in nursing. Sometimes in different cultures or even different parts of the country, there are different communication styles. We express ourselves differently. Maybe the loudness of our voice, the rhythm, or the different qualities of our speech, our body posture, whether we make eye contact or whether that's considered rude or intrusive. We need to be culturally sensitive to this and just be aware of the fact that other people may consider things differently than we do. The issue of personal space varies from culture to culture. We may be comfortable having a conversation outside of when there's a global pandemic and COVID of maybe being within 3 feet of someone. Other cultures may be a little bit more distant. They may expect you to be 6 feet apart. Otherwise, it feels threatening or intrusive. In terms of family relationships, some cultures believe it's more important not to go to work if you have a child or a family member who's sick. Other cultures may value the work ethic more than being home with a sick child, and that's not our place to judge either way. Similarly, time orientation is very different for various cultures. To some of us, being on time is very important. Other people from different backgrounds and other cultures may value just being a little bit more laid back about the whole thing. Our next item for discussion is workplace discrimination. The Civil Rights Act, a very famous federal law of 1964, provides for most healthcare organizations or any workplace that has 15 or more employees, they cannot make workplace decisions based on race, color, gender, age, disability, religion, or national origin. They can ask about these issues, some of them at least, on applications, but they can't make a hiring decision based on any of these criteria. Let's go back for just a minute to the concept of workplace stress and burnout. There's a lot of burnout in nursing, so it's important to know this and know how to manage it when you feel it coming on, and especially how to prevent it. What are the signs that your stress level is too high at work? It could be that you wake up dreading going to work in the morning. You just can't stand the thought of getting out of bed. You may find yourself ruminating or thinking over and over about small failures or mistakes that you made when you should be able to let these go. You may avoid getting certain assignments or doing certain work. You may avoid your colleagues. You may find yourself having a little bit too much to drink after work or worrying about all of the above. In order to manage the stress of a registered nursing job, it's going to be important that you do your self-care. And there are 4 parts to self-care: physical, mental, emotional, and spiritual. Exercise is important to relieve stress. This doesn't mean that you have to go work out at the gym several days a week. It could be as simple as putting the dog on a leash and taking a 15 to 20-minute walk around the neighborhood in the evening or whenever your free time is. It could be as simple as finding a yoga video that you like on YouTube that's free and do 20 minutes of stretching at the end of the day. Um, Try to get 6, 7, 8 hours of sleep every night. This improves your frustration tolerance, your ability to be mentally agile, and your attention span. And do something spiritual every week. This doesn't mean that you have to be religious. Spirituality can also have to do with the meaning of life. It may be just a brief meditation or prayer every week in the privacy of your own home that helps remind you what's important in life to you and why you get up in the morning and do what you do. Part of self-care is doing a self-assessment, and this means defining what does health mean to me. If we don't keep ourselves healthy, we are not going to be there for others in terms of our patients, our family, and so on and so forth. Do a critical examination of your own behavior and lifestyle and answer the question, what prevents me from living my definition of health? What is important to me? Where do I find support? And how do I figure out coping mechanisms? How can I reorganize or reduce the tasks so that I can prioritize what I'm doing in order to have more balance in my life? For some, this may mean leaving the dishes in the sink while there's still daylight to go out and walk your dog. Take a 20-minute brisk walk around your subdivision or your neighborhood. You will certainly feel better and more relaxed when you get back. When you get back, the dishes will still be there, and then you can load the dishwasher. But this is figuring out in your own life what's important, where you can carve out a little time for something pleasurable or helpful for you in order to feel better about your situation as a whole. The other part of your self-assessment for self-care is figuring out what your long-term goals are. This is one of the things that we ask everyone in the mock interview yesterday. What are your hopes and dreams for the future in terms of your career, your physical needs, your finances, your family, and so on and so forth? So the term burnout is a result of unmediated, unresolved, chronic long-term job stress. The definition is a progressive deterioration in your work skills and other performance resulting from increasing difficulties in coping with high or severe continued level of job stress and professional frustration. What are some tips for coping with everyday work stress? You should spend time on outside interests just to take your mind off things. Sometimes when I'm really frustrated with the situation, if I take time out and watch a movie, especially a comedy, when I come back to my problems, they seem not quite so bad because I've taken steps to elevate my mood. So nothing's changed other than I think about the situation differently. So another thing you can do is always have someone to talk to. If you are at a job and you're not able to develop rapport with at least one coworker, this is probably not the right environment for you. Maybe it's nobody's fault. You're just not seeing eye to eye. It's just not gelling or coming together for you. So this is probably not going to be a work environment where you will be able to receive adequate support in order to maintain interest to stay on this job. It's important also to realize that you don't have to say yes all the time. Don't exceed your limits to the point that you are overly tired or frustrated, because then you're not going to be very effective. Um, Please feel free to say no sometimes, and also realize that you can teach other people how you like to be treated. If you are always the go-to person to stay overtime and you learn to say no just a little bit, then you will decrease your stress and risk for burnout, and let other people on the unit share in the overtime sometimes. Most people can find some job satisfaction and a reason to get up in the morning and enjoy their work in spite of a stressful situation. Um, a lot of it is self-reinforcing. If you are doing a good job and your patients are getting well, if you are recognized by your employer and being treated well, then probably good things are going to happen for you. As you already know, the work of nursing is not easy, and there are going to be some stressful days in your work situation. However, there should be more good days than bad. I think that's how you know if you're in the right place and on the right track. Please always remember, when nursing gets stressful, that this is a profession filled with a great deal of personal meaning and satisfaction. You are making a difference in the world. You can control your stress and you can prevent burnout. Thank you.